Okay, the skeletal system, Chapter 7. We will talk about the skeletal system separated. I'll separate the axial skeleton, and then we'll turn around and talk about the appendicular skeleton. So it's in two parts. So divisions, of course, of the skeletal systems, what we'll talk about. We'll talk about the different types of the bones, bone surface markings on each one of the bones, the skull, the hyoid bone. We'll talk about that. We'll talk about the vertebral column and the thorax, and the appendicular skeleton. That's what we'll talk about. The human skeleton, of course, has 206 named bones, so you do need to know numbers within this chapter. And that's in the human skeleton. So they're grouped into two different principal divisions. That's your axial skeleton and then your appendicular skeleton. So part one, we'll talk about uh, the axial skeleton, and then in part two, we'll talk about, of course, the appendicular skeleton. So you have divisions of the skeletal system. We're still continuing on the PowerPoint slide. You have the axial skeleton. These are going to lie around the longitudinal axis of the human body. So this is going to be the skull bones. And if you look at the picture here, it's highlighted kind of in gray out the axial skeleton. The auditory ossicles, which are the ear bones in the ear. Your hyoid bone, which is of course through here. Also ribs, sternum, again the bones of the vertebral column. So you can see that this area here is going to be your axial skeleton. So you do need to look over here and know that your axial skeleton contains 80 bones total, and it breaks it down into each one. So the cranium has 8, your face has 14, and you do need to know each one of these separate. Hyoid is only 1 bone. Auditory ossicles, there's 3 in each ear, so that makes 6. Vertebral column, you have 26 bones. The thorax is broken down to sternum 1 and your ribs 24. So all those add up together to be 80. Next, you have your appendicular skeleton, and you have a total of 126 bones, of course, in your appendicular skeleton. They're going to consist of the bones of the upper and the lower limbs and extremities, plus the bones that are help form the girdles that are going to connect the limbs to the axial skeleton. So you can see this colored here in gray. For the basic skeleton, you do need to be able to label it. Um, so be able to label the cranium portion, the facial, clavicle, scapula, sternum, ribs, the humerus, which is the upper arm, the forearm or lower arm bones is the ulna and the radius, the wrist bones are the carpals, the palm of the hand will be your metacarpals, fingers or the phalanges, some books will call those digits. Um, Then you have, of course, the lower limb, which is going to be the leg bones. Of course, it's going to be the femur, the patella, which is your knee bone. The lower leg, you have the tibia, which is your shin bone, of course, and the fibula. Uh, then you have your tarsals, metatarsals, phalanges. You should be able to label those. This right here, of course, shows you the hip girdle, the pelvic girdle, and up here shows you the pectoral girdle as well too. Make sure you label the vertebral column and the pelvic hip girdle. Of course, as we go through the slides, we'll go through each one of these sections in a little bit more detail. Okay. First, we're going to talk about the types of bones that we have. Bones can be classified into 5 types based on their shape. So again, I'm going to go through the examples of these on the next few slides, but the long bones, those examples of here would be the humerus, short bones. These are going to be like bones in your wrist, bones like your carpals, flat bones. Of course, this is going to be an example. This will be the sternum. Also, we have some on the skull that we'll talk about later. Irregular bones, these are going to be bones that don't fit into the other categories. Sesamoid bones, example of that would be patella. So, but we'll actually go through, this is a kind of an outline of what we're going to go through on the next few slides. So long bones, of course, they're going to be greater in length, okay, than they are in width. Okay, so they're slightly curved for strength. Your examples of those are going to be your femur, your tibia, your fibula, your humerus, ulna, radius, and the phalanges. Next, you have your short bones. These are going to be your cube-shaped bones. Okay, so they're going to be the ones in your wrists and in your ankle area. So your carpals and your tarsal bones. They're nearly equal in length than they are in width. So you can see that here. Okay, flat bones, these are going to be very thin bones composed of nearly parallel plates of compact bone tissue. They're closing a layer of spongy bone tissue. You have, of course, they're examples of your cranial bones. So the cranial bones are going to be like your occipital bone, your frontal bone. Here's a few examples of your cranials. Parietal bone, your nasal bone, and the lacrimal bone. Those are a few examples of the cranial bones that are flat. You also have your sternum, the ribs, and the scapula, and also the os cox bone, which is your hip bone, of course, is also a flat bone. Irregular bones, these are going to be complex shapes that cannot be grouped into any of the previous categories. Examples of those, because they had odd shapes, is your vertebra. We've already looked at that one. This right here should be not hip bones. It should be sacrum. Some facial bones, of course, may be considered irregular bones. The calcaneus bone, of course, that's your heel bone as well. Your hyoid bone is an irregular bone. The coccyx is also another example of irregular bone. You also have zygomatic bone will be irregular. So those are some examples. Your sesamoid bones, of course, protect tendons from excessive wear and tear. So sesamoid bones is a bone, of course, that's embedded in a tendon or a muscle. Okay. Okay, so examples of these would be your patella, your foot. You have two that are found in the metatarsals of the foot. You have two that's in the hand, and it's the first metacarpal and the second metacarpal of the hand. Sutural bones, these are, of course, are going to be small bones that are located in sutures of the cranial bones. We'll talk about those a little bit more detail when we talk about the different sutures in the cranium. So bone surface markings, this is kind of an outline or basic information of what we're going to go over in the next few slides, but you have bones that have characteristic surface markings, structural features adapted for specific functions. You have two major types. You have depressions and openings, and what these are going to do are going to allow the passage of blood vessels and nerves or to run through, or some of them can help form joints. Processes, these are going to be projections or outgrowths that form joints or serve as attachment points for ligaments and tendons. Okay, so first we have here is we have the fissure. That's kind of like a narrow slit because it's like an opening, but it's kind of narrow. And I'm not an artist, but I'm going to draw a little bit of an example there. But it's a narrow slit, excuse me, between the adjacent parts of bones through which blood vessels or nerves are going to pass through. And one example that we will talk about for this one is the superior orbital fissure. And I'll try to write these on the board for you. Next, you have the foramen. A foramen is also an opening, but it's a circular opening. So this is going to be which blood vessels, nerves, or ligaments are going to pass through there. So some examples of things, some that we're going to talk about. Some of the main ones is the foramen magnum. We'll talk about the mental foramen. And we'll talk about the supraorbital foramen, and there's also an infraorbital foramen. Next, you have the fossas. These are going to be just what it says, shallow depression. So, a lot of times another bone will articulate within it. Okay, so it helps to form joints. And another one, of course, an example that we'll talk about, one of the examples, we'll talk about a few of them, but the mandibular fossa. And your mandibular condyle or your condylar process will articulate with that mandibular fossa. So the sulcus, of course, this is a furrow-along bone surface that accommodates blood vessels, nerves, or tendons. And of course, this is an example of this one that we're going to talk about is the intertubular tubercular sulcus of the humerus. And next, the tube-like opening we'll talk about is the ear canal, and also which is called the external auditory meatus. Okay, and this one also has another name. It can be called external acoustic meatus or external auditory meatus. Next, we have a condyle. All of these on this paper here are going to help to form joints. So first you have the condyle. These are large round protuberances at the end of a bone. And what they do is they articulate in a fossa or with another bone. So, and one example that we'll go over is your mandibular condyles. And this one also has another name, condylar processes. And we'll also go over your occipital condyles. So those are a couple examples of condyles that we'll talk about. Facets, these are surfaces where there are smooth articular surfaces. There's two bones that usually articulate together. Okay, and the rib facets is one that we'll talk about this one. Next you have the head. This is a rounded articular projection that's supported on the neck. It has a constricted portion of a bone. And we'll talk about, of course, the head of the femur. And of course the head of the humerus is another one we'll go over. Okay, these are processes that form attachment points for connective tissues. The first one here is the crest, is the prominent ridge or elongated projection. An example of this then that we'll talk about is your iliac crest. We'll also talk about the intratrochanteric crest, epicondyles. These are medial or lateral epicondyles. These are just projections above a condyle. So we'll talk about these, of course, on the humerus. Line, this is a long, narrow ridge or border. It's going to be less prominent than a crest. Spinous process, these are going to be sharp, slender projections that we're going to talk about. So we'll talk about the spinous process, of course, on the vertebra. Then also trochanter, these are going to be, sorry about that, these are going to be very large projections. Tubercles will be small rounded projections. And of course you have tuberosities. Of course these are going to be large rounded, usually roughened projections. So the trochanter example that we'll go over is going to be the greater trochanter, the greater and the lesser trochanter of the femur. The tubercle, we'll talk about the greater tubercle and the lesser tubercle of the humerus on that one. Tuberosity, we'll talk about the ischial tuberosity and the tibial tuberosity, or some of the two ones of those we'll talk about. So here are some checkpoint questions. What bones make up the axial skeleton? And of course, these are all in your notes. So, but you know, your skull, which contains the cranium, your facial, the hyoid bone, auditory ossicles, vertebral column, thorax. So you have your sternum and your ribs. What bones make up the appendicular skeleton? That's going to be the pelvic girdle and the pectoral girdle. So pectoral girdle will be the clavicle, the scapula, the upper limbs, humerus, ulna, radius, carpals, metacarpals, your phalanges. The pelvic girdle will be the hip and pelvic area, coxal bone. The lower bones, limbs are going to be the femur, patella, fibula, tibia, tarsals, metatarsals, and your phalanges. Okay. So those are all those pictures that I have given you at the first. But just make sure, some of the questions I'll ask on the test is I may say which of the following is a bone in the axial skeleton, or which of the following is not a bone in the axial skeleton, or which of the following bones is in the appendicular skeleton. So make sure that you can differentiate between which bones go in the axial skeleton and which bones go into the appendicular skeleton. So first, your skull, of course, is also known as your cranium, consists of 22 bones. Bones of the skull are grouped into two categories. That's cranial and your facial bones. And if you remember back, you have 8 cranial bones and 14 facial bones. So the cranial bones, the 8 cranial bones that you have, of course, you have 1 frontal bone, 2 parietal bones, 2 temporal bones, occipital bone, sphenoid bone, and ethmoid bone. Your 14 facial bones are your 2 nasal bones, 2 maxilla bones, 2 zygomatic bones, your mandible bone, your 2 lacrimal bones, your 2 palatine bones, your 2 inferior nasal conchae bones, and the vomer bone. And we'll go through all these on the next few slides in a little bit more detail, but I just wanted to kind of write those out so you know which bones were which. So first of all, make sure that you know, of course, or can label the following parts of the skull, and I'm just going to put a little check mark beside them because we're actually going to go over them on the next few slides separately. But I like showing it to students all in one area, so you can kind of, if you have a highlighter, you can go through and highlight it. But the supraorbital foramen, you don't have to know the margin, know the optic foramen, superior orbital fissure, temporal bone, nasal bone, inferior orbital fissure, I don't make you know. Nasal conchae, you need to know that, or concha. Inferior orbital foramen, so you should be able to label these on a picture. When you go to lab, we'll look at them in the models. Alveolar processes of both the maxilla and the mandible. Mental foramen, your vomer, your inferior nasal concha, perpendicular plate of the ethmoid bone, zygomatic bone, lacrimal bone, ethmoid bone, the orbit, sphenoid, your squamous suture, which you can't really see that good from that side, but parietal bone and the frontal bone. So the skull, you have the cranial and the facial bones protect and support special sense organs in the brain. Besides forming the large cranial cavity, the skull also forms several smaller cavities. So you have the nasal cavity. The orbits is a cavity. That's because they're your eye sockets. That's where your eyes go. Paranasal sinuses. These we'll talk about later again too, but these are going to be your air-filled spaces. Okay, and they communicate with the nasal cavity. And they also have small cavities which house organs involved in hearing, of course, in equilibrium. The skull also provides large areas of attachment for muscles that move various parts of the head. You have immovable joints, which are called sutures. Okay, these are going to fuse most of the skull bones together, and they actually consider them they're very, very, very small bones. So it provides a rigid joint between two or more hard elements, and they're held together, of course, by fibers. So these, of course, sutures you need to know, and of course it just shows you one here. This one, of course, right here is called the sagittal suture. The one back here in the back, and a lot of times too, like this one, the sagittal suture, it'll tell you it's a landmark because it separates the two parietal bones. This one back here in the back is the lambdoidal or lambdoid. Suture, okay, and that one is a landmark or boundary between which separates the parietal bone from the occipital bone. Okay. And then, of course, the one up here at the top is the coronal suture. And of course, this will mark the boundary between, or between the frontal bone and the parietal bone. You could also say that it allows the frontal bone to articulate with the parietal bones, or the sagittal suture allows the two parietal bones to articulate. There is another one, and you cannot see it because it's right above, and I'm just going to draw it in here, even though we're not looking at the temporal bone, but it's right above the temporal bone, and that's called the squamous suture. So that bone would, that suture, the squamous suture, would separate or be a boundary between the temporal bone and the parietal bone above it. Skull and facial bones provide, the function, of course, is to provide attachment for muscles that produce facial expressions, and it's also going to move various parts, of course, of the head. You have the facial bones form the framework of the face, provide support for the entrances to the digestive and the respiratory systems. So next we're going to start going through all the bones. So the first one, of course, is your frontal bone. And of course that is located here. And usually what I'll do is I will tell you, I'm going to label it F. Okay. So what I do is I go over here and I'll label it on your picture F. And I did that because frontal starts with F. So that way you can, when you go back and study, you can kind of try to look at them and kind of memorize the pictures. That's why I put pictures on here that wasn't labeled. And you don't have to label it, but you can kind of use it to study with. But the frontal bone, of course, is going to form the forehead. Uh, and of course, remember your coronal suture, and I'm going to abbreviate suture with the S period. And I'm going to say separates instead of boundary, but it separates, and I'm going to abbreviate the SEP, the frontal bone, of course, and the parietal bone. So you could also say it serves as a boundary between the frontal bone and the parietal bone, or you could say that it allows the frontal bone to articulate with the parietal bone. Okay. Parietal bone, of course, I'm going to put a P here. So the parietal bone, you have one on two of those. You have one on each side. They're separated by the sagittal suture here. So I'm just going to draw them back in here. So your sagittal suture is going to separate or be a boundary between the two parietal bones. But the parietal bone, what it does, it forms the sides and the roof of the cranial cavity. Next, you have your temporal bone here. I'll label it T. So it forms the lateral aspects in the floor of the cranium. And that squamous suture that I tried to draw in on the other one is, of course, right here. Okay. So that is your squamous suture. And what it's going to do is going to separate the temporal bone from the parietal bone. Okay, so that serves as a boundary between the parietal and the temporal bone. And also, the lambdoid, I'm going to put it in blue here, just because it's so close there. The lambdoid suture, just since I'm going over, I'll just finish going over all of those again. The lambdoid suture, of course, is going to separate your occipital bone, which is back here, from the parietal bone. Okay. So that serves as a boundary between the occipital bone and the parietal bone, or you could say it articulates with it. Also, too, here in a little bit, I'll go over on the next few slides that your temporal bone, of course, is going to form, since we already talked about the temporal bone, the temporal bone also forms your mastoid process, styloid process, and the external auditory meatus, which I'll put on another slide for you. Your occipital bone, again, is back here, and I'll put an O for it so we can kind of label it, our picture for you. The occipital bone, it forms the posterior part and the base of this cranium. Is going to form also your foramen magnum. And the foramen magnum, of course, is the largest foramen in the skull. And also is going to form your occipital condyles. The sphenoid bone, of course, we're going to label it S. It goes here. Go back to red. So your sphenoid bone, of course, lies at the middle part of the base of the skull. You can see it on both sides of the skull, but this is the tricky one. It is only one bone. It's very fragile. Inside, it looks like, some people say it looks like a butterfly or a bat's with its wings out. Okay. But it is, of course, just one bone, and it just goes all the way across. So your ethmoid bone excuse me, it separates your nasal cavity from the brain. So it is located on the midline of the anterior part of the cranial floor, medial to the orbit. It's a major superior supporting structure of the nasal cavity. It contains thin projections called conchae, which are going to be lined by mucous membranes. So there's increased surface area in the nasal cavity, so it's going to help it to humidify inhaled air, trapping inhaled particles. The conchae bones, these are, of course, are the bones inside your nasal cavity, which we refer to as concave bones. Okay. And then the ethmoid bone, of course, is located here. And I will go ahead and write on here, it separates the nasal cavity from the brain. Okay, so here is showing you a picture of a few things we've already went over. So up here, this one, and if you want to pause the video and kind of quiz yourself on what bones you already know, I would recommend that. But I'm just going to go through here and name a few parts that we've talked about. Some of them I've labeled, some of them I haven't, but we'll talk about, if I don't haven't already talked about, we'll talk about it before the end of the chapter. But this right here be the frontal bone. This bone here is your parietal bone. This is your temporal bone. And you can see that they're color coded so you know where they start and stop. Your occipital bone. This one, of course, is your sphenoid bone. And we've already talked about the ethmoid bone here. Okay. We also, I'll switch colored inks. For the sutures, this right here, of course, is the coronal suture, and I'll abbreviate it CS. This right here is your sagittal or squamous suture. Okay. And I should put SQ for squamous suture. This right here is your sagittal suture. Okay. This one right down here that separates your occipital bone from the parietal bone, that's going to be the lambdoid suture. Okay. So a few things extra that we're going to go over on the next few slides is, of course, we've already went over the mastoid process. I told you but I'm going to go over it again here in a few minutes. But this right here is your mastoid process. This one right here is your styloid process. And the ear canal here, that's your, I'm going to abbreviate it, external auditory meatus, EAM. Okay. So I just want to kind of go over those real quick. We've already talked about those. So sometimes I'll tell you what parts of the skull does the temporal bone form. And remember, it forms the external auditory meatus, the mastoid process, and also forms that styloid process. Okay. And we talked about what the occipital bone forms, and it forms the foramen magnum. It also forms those occipital condyles. So here is showing you that lateral view with it all labeled. So everything that we talk about in the writing, make sure that you can label that on the pictures. And what I could do, I'll highlight these for you. So make sure that you can label the mandible, the maxilla, the mandibular fossa, the tip. Oh, sorry, you don't have to do the temporal process. Nasal bone, the lacrimal fossa, which is the tear duct, lacrimal bone, ethmoid bone, zygomatic bone, sphenoid, frontal bone. Make sure you do parietal bone. Make sure you know the suture here. Make sure you know the squamous suture, your temporal bone, zygomatic process we'll talk about, lambdoid suture, occipital bone, external auditory meatus. You could also call that acoustic meatus, mastoid process, styloid process, and occipital condyles. You can see a little bit underneath there. From, just in case you see pictures on the test or the quizzes, of course, with this view, you should be able to label the palatine processes, which we'll talk about here in just a little bit. Palatine bone, your vomer from this angle, the mandible, the occipital condyles, mastoid process, styloid process, temporal bone, occipital bone, your parietal bones, lambdoid suture. It shows you right here where they're separating the occipital bone from the parietal bones, and your foramen magnum. And that's all you need to label in this picture. So next we have your nasal bones. Of course, they're going to form the bridge of the nose. So there are two bones. Okay, and they're small, oblong bones. So, what people refer to as your nose is actually the tip of your nose. The tip of your nose is made of hyaline cartilage. Okay, so the actual bone is back here. Okay, so the inferior nasal conchae, of course, you have inferior, you have superior, but you just see in this picture, you can only see the inferior ones here. They're on the inside. Those are concave bones. They form a part of the inferior lateral wall of the nasal cavity. They're actually going to be covered with epithelium, and it secretes mucus, and it also contains cilia. Your nasal septum, of course, what it does, excuse me, it divides the two nostrils into right and left halves. So if you have a broken nose, sorry about that. So if you have a broken nose, in most cases, it refers to the septal damage rather than the nasal bones themselves. Okay. So the nasal septum is actually divided into two parts, the vomer and the perpendicular plate of the ethmoid bone. So this right here again is your nasal bone. The nasal septum is this right here, this whole thing, but it's separated into two parts, and you see it's color coded. So I'm just kind of making it larger than what it is. But if you look here, the top part or the superior part of that nasal septum is the perpendicular plate of the ethmoid bone. So you can put that's a superior portion. Of nasal septum. And then down here you can see the inferior portion here would be the vomer. Okay, so the inferior portion of that nasal septum is the vomer. The superior portion of that nasal septum is the perpendicular plate of the ethmoid bone. Again, here is a picture of what we've already went over. We've talked about already. This right here, of course, is your nasal bone. This whole piece here is your nasal septum. They color coded here. The top part is going to be your perpendicular plate of the ethmoid bone. I'm just abbreviating it there. And if we do the other bottom part in orange, that's the vomer. Okay. We also talked about the nasal conchae. So right here shows you the concave bones. Okay, next we have the palatine bones. These are, of course, going to form the posterior portion of the hard palate. So everything in front of it is going to be part of that is going to be the maxilla bone. The zygomatic bones, and of course you can't see it on this picture, I apologize. Zygomatic bones are going to be the cheekbones here. And I put a Z for the labeling it. You also have lacrimal bones, which form a part of the medial wall of the orbit, and they contain the tear duct. So if you look here, it's colored purple. That is your lacrimal bone. And that little opening here inside, that's your tear duct opening. So just a few things to know about the lacrimal bone. It is the smallest of all the bones in the skull. It is very thin and considered a little, what they refer to a little bone. The tear duct is what they refer to as the lacrimal duct, as well as two. Next, we have the mandible. That's down here. We'll label it M. That's the lower jawbone is a fusion. It's actually a fusion of two bones, of course, at the mental symphysis. The mental symphysis is this little area, raised area here. That's where the two mandible bones are fused together. So it is the largest and strongest facial bone, and is the only movable skull bone, what they refer to as free, movable. Maxilla, of course, this is the one that forms the upper jawbone. It forms most of the hard palate as well too. But you can't see the hard palate right now because the mouth is closed. But this is the maxilla, I'll abbreviate MAX. It separates the nasal cavity, of course, from the oral cavity. The maxilla, of course, is also the fusion of two bones at the palatine fissure. Also, both the mandible and the maxilla form what they call alveolar processes. Alveolar processes help support the teeth, or the tooth socket or teeth sockets. You can see these processes here. These are the alveolar processes. Another thing that we'll go over in lab is that these the openings here, and these are called the mental foramen. They are on the mandibular or mandible bone. Next, we have the orbits, which are here. Okay, these are cavities, or the orbital cavities. They are your eye socket, or a bony socket for the eyes. Your foramina, of course, these are openings for blood vessels, nerves, or ligaments of the skull. And again, we've already talked about that. You have two on the mandible, and these are down here. These are the mental foramen. Okay, then you have two up here above the orbit. These two here. These are called the superior orbital foramen. Okay, and then the ones below the orbits are called the infraorbital foramen. I should have color coded those. And we'll redo that. Infraorbital foramen. The superior orbital foramen would be here. Those two at the top above the orbit. And then, of course, the mental foramen will be down at the bottom, here on the mandible bone. So just a review. So what you could do here is review everything that we've talked about from this angle. Again, this is your frontal bone. These are your zygomatic bones, which are the cheekbones. Just some things that you can see, obviously. This is your maxilla bone. This is your mandibular bone. These are your mental foramen. Here you have your orbits. The supraorbital foramens you have above here. And below you would have the infraorbital foramen. Okay. Nasal cavity, or nasal bone here. You have your nasal septum. Nasal septum, again, remember, is broken down to two parts. The superior portions of the perpendicular plate of the ethmoid bone. The bottom part is going to be the vomer. The sockets around the teeth here, this bony structure or process is called the alveolar processes. So I like to do lots of reviews. So some of these slides that I'm reviewing, if you don't want to look at them, you can skip by them. Here is another slide. It's going over the external auditory meatus, which we've already talked about, styloid process and the mastoid process. All three of these are formed by the temporal bone. Okay, so the external auditory meatus can also be called acoustic meatus, and that's just the ear canal. And it's hard to label that one. Okay, so there it is. This pointy one down here is going to be your styloid process. I'll abbreviate it SP. MS for mastoid process. That would be the process here located on the other side. Another review again. This is just showing it to you a little bit enlarged. This is your mastoid process. This would be your styloid process. And this is going to be your external, this area here, external auditory meatus, or you could say acoustic meatus. Next you have the foramen magnum, and that is this opening here, and I'm going to abbreviate it FM, just so I'll have to draw a bunch of lines. I know it's kind of hard to see when I do that. I apologize. Foramen magnum, of course, that's that opening, is formed by your occipital bone. And it is considered the largest foramen in the skull, not the body, but the skull. Okay. So next you have the occipital condyles, and I'll abbreviate those OC. They are on each side here of the foramen magnum. So your occipital condyles, that's this little area here. Okay. So what they do is they are going to be formed by the occipital bone as well too, and it articulates with the C1 vertebra, the atlas. Okay, next you have your jugular foramen, and I'll put JF for those. They're here. So your jugular foramen, of course, this is a passageway for your jugular artery and vein. Sorry about that. Next, you have your carotid foramen. And of course, that's right here. I'll just put C for that one. The carotid foramen, of course, that's going to be a passageway for the carotid artery and vein. And so next on this side, we have your mandibular fossas. And of course, that's this, we're looking at it from the roof of the mouth area. So we've taken the mandibular bone off, is what you're looking at. We're looking underneath it. So this right here is your mandibular fossas. And what they do is they articulate with that mandibular condyle to form a joint. Okay, so next we have your zygomatic arches. So make sure that you know those, and that's of course located here. The palatine processes, these are going to be located, of course. This is actually considered the palatine bone here in the blue, but the processes are these little roughened areas here on the maxilla bone. So those would be the palatine processes. The incisive foramen would be also located here near the incisive teeth, or the incisor teeth. Next, on these three, all three of these are part of the ethmoid bone. Okay, so you have the cribriform plate, olfactory foramen, and the crista galli. So the cribriform plate, of course, this is going to support the olfactory bulb. And then you have the olfactory foramen, which is the passageway for the olfactory nerves. And then we have the crista galli, which is the attachment of the falx cerebra. Okay, so over here on your picture, these are going to be kind of hard to label because they're small, but the cribriform plate is all this around here. Okay, the crista galli, I can change inks here, is this little raised area, kind of like a little process. So the crista galli is there. So crista galli is in the middle. The cribriform plate is around it. So I tell people all the time, if you can, it is kind of silly, but it kind of helps people to remember which one's which. But the Krista is a baby, so her name is Krista Galli, and she's in the crib, and she's in the cribriform plate. Okay, so the cribriform plate kind of goes around it, and then all these little openings here in the cribriform plate are the olfactory foramen. Next, of course, you have the hypophyseal fossa, which is this inner piece here, and it is a fossa. That, of course, I'm going to try to change the markers again. I apologize. But the hypophyseal fossa, of course, holds the pituitary or houses the pituitary gland, or also known as your hypophyseal gland. So that's how it gets its name. And it protects it. The sella turcica is a landmark area of course, the sphenoid bone. So this whole area here is considered the sella turcica. So that's just a landmark area. And then, of course, you also have your optic foramen. And your optic foramen, of course, you can hardly see them. They're right here on each side. And the optic foramen, of course, is the passageway for the optic nerve. So I usually also tell people to make sure that you know which bones are which from this inside of the cranium. And of course, down here is your occipital bone. Over here would be it's in pink, is the pinkish color parietal bone. This right here would be your temporal bone. This green area here is the sphenoid bone. Some people call it sphenoidal bone or sphenoid bone. Some people say it looks like a butterfly or like a bat with its wings spread out, and that's the green part here. So this right here, of course, is the sphenoid bone, and this sphenoid bone, of course, forms that hypophyseal fossa, the sella turcica, and the optic foramen. Next, we have the mandible. So we have a few parts on here. You have the condylar processes, which is here. Some books will call it the mandibular condyle. So it's also known as the mandibular condyles. Okay. They form, of course, your TMJ, which is your temporomandibular joint, um, along with the mandibular fossa. So you have your mandibular notch, of course, is right there. The mandibular notch is a passageway for nerves and vessels. And then also you have your coronoid processes, which is also here. They're also known as your mandibular processes. Next, the alveolar processes. These contain the teeth sockets. We've already talked about those. Um, your mental foramen, of course, again, we've already talked about this one a little bit already. It's the two openings on the mandibular bone, serves as a passageway. And then you have your mandibular foramen, which are on the inside. Again, if you want to, you could use this as a way to review. Um, you can see the vomer from this angle. I can't remember if I went over that or not. That's this section here. Okay. Um, we already talked about the mandibular fossa right there. We talked about the foramen magnum here. Your occipital condyles on each side. Again, you could pause this before I start doing this and kind of quiz yourself. This one right here on each side will be the jugular foramen. And then above it is going to be your carotid foramen. Right here will be your palatine bone. Okay. This foramen here, you need to know, of course, that's your palatine. Or it actually has two names. I told you the incisive foramen is what it's called, and it is, but it's also known as your anterior palatine foramen as well, too. And again, here's an extra one if you want to look at this one and kind of quiz yourself with it. Here is a video that I cannot get to play on this actual recording, but you should watch this recording. It shows her going over parts of the facial bones. Here's another one on the cranial bones. Skull, you have some unique features of the skull. That's going to be sutures, paranasal sinuses, and your fontanelles. Again, we've already went over the sutures. Those are immovable joints that hold most of the bones together. We've talked about the coronal, the sagittal, squamous, and the lambdoidal are the ones you need to know. And they're going to form boundaries between the bones. Next, you need to know the paranasal sinuses. These are cavities within the cranial and the facial bones near the nasal cavity. They have secretions that are produced by the mucous membranes which line the sinuses, drain into the nasal cavity. They serve as a resonating chambers that intensify and prolong sound. So these, of course, they usually empty out every 10 minutes. Then you have about, of course, 2 quarts that go through sinuses every day. Okay, so first we have here the different sinuses. You know, and of course you have the frontal sinus, and that's going to be like coded here. I'll put F for frontal. Okay, and they're just your description of those would just be superior to the eyes. The next one, of course, you have is your ethmoid sinus, and those are the red ones. And I'll just put in red here. And of course, those are going to be between the nose and the eyes. This is my shorthand for between, B for B, tween, T. T. So it's between the nose and the eyes. Then, of course, you have your maxillary sinuses. I'll put an M on it, on those. Okay, so those are in the maxillary bone. So those are going to be the largest ones, the largest sinuses. And then they're considered inferior to the eyes or under eyes. Next, you have your sphenoidal sinuses, and these are the ones in green. You see them a little bit here, but see it a little bit better from this angle. So these are the ones in green. They're going to be considered in the center of the skull base under the pituitary gland. Okay, next we have the fontanelles. And the fontanelles, of course, they are going to allow the brain of an infant to grow very rapidly. So they're areas of unossified tissue. At birth, these unossified tissue spaces commonly are called soft spots. That's what a lot of people refer to them as. They leak the cranial bones. They eventually are going to be replaced with bone to become sutures. They provide flexibility to the fetal skull, allowing the skull, of course, to change shape as it passes through the birth canal. The different ones we have here is the first one up here in the front. Okay, that's going to be the anterior fontanelle. That's the largest fontanelle. That's commonly called, that's one they usually commonly call the soft spot because it is the largest. It usually takes about 24 months or persists until about 24 months. So it takes about, of course, and some books will say 18 to 24 months after birth to close off. Okay. Covers a major blood vessel, pulses as the heart beats as well too. The sphenoidal fontanelle, it's also known as the location name of it. It's called anterolateral fontanelle. Because it's near the front but also on the side. Okay, so your sphenoidal fontanelle, of course, is going to be through here. That's the junction of squamous and coronal sutures. Your mastoid fontanelle, of course, is going to be located here. It also has another name according to its location, and it's also known as your posterolateral fontanelle. So it's a junction of the squamous and lambdoid sutures. And then you also have your posterior fontanelle, which is back here in the back. That's the junction of the lambdoid and the sagittal sutures. But they say the posterior fontanelle, it closes at because it ossifies. It closes at about 2 months after birth. The mastoid, going back up through here, the mastoid fontanelle, they say it takes about 12 months for it to close off. And then, of course, your sphenoid fontanelle takes about 3 months to close off, and these are after birth. Okay. And remember, your anterior one will take up 18 to 24 months, up to 2 years to close off. So next we have here how many bones, of course, is the skull made of. Remember, your skull is made of 22 bones. Which 7 bones form the orbit? And this would be your ethmoid bone, your lacrimal bone. I'll put B for bone. Zygomatic bone. Your frontal bone. Your maxillae bone. And your palatine bone. And also your sphenoid bone. So those are the 7 bones that help to form the orbit. What is the function of the nasal septum? And of course, that's going to be that it forms the nasal passageways. So define TMJ. Remember, that's the temporomandibular joint syndrome. Again, ignore this page number. That's from an old book. But that is a clicking or popping noise when opening the mouth. It's limited or abnormal opening of the mouth. So it's caused, sometimes can be caused by improperly aligned teeth. It can be due to trauma to the head. If someone has a habit of grinding or clenching their teeth, it can cause that as well too. A deviated nasal septum, that's just where the nasal septum does not run along the midline of the nasal cavity. It usually bends to one side more than the other. Define sinusitis, that is an inflammation of the mucous membrane of one or more paranasal sinuses. Okay, what I'm going to do here is I'm going to stop this recording here since this is about an hour-long recording, and then I'll post probably about 2 or 3 more recordings. So I'll break it up into shorter recordings instead of doing a 3-hour recording. So this will be part 1.